So, we had a hearing yesterday, small business and finance with the IRS and our code, which is a mess. And one of the comments I made is, the solutions being put forward, the little bills and stuff, so it's like putting a Band-Aid on a dying patient. And I think we're kind of hearing the same thing here, quite honestly. And again, I truly appreciate this is a nonpartisan hearing. This is excellent information, but in my brief time period, we've done a good job describing the problem, but I don't think we're properly diagnosing it. I don't think we're really getting down to the root cause. And Dr. Cooper, you're the economist here. Yeah, again, I believe in the magic of the invisible hand, right? Where you have millions of consumers and hopefully thousands, tens of thousands of providers, and just magically, you don't need to do regulations on price transparency. It just happens. Consumers get the best possible product, the best possible customer service, the best possible price. That's what a free market does. We've largely driven consumerism out of healthcare. It doesn't have to be this way. Isn't it true that decades ago, patients paid for 80–90% of their own health care? Now they pay about a dime. So, Ms. Pearson, what good is price transparency if consumers couldn't care less what it costs? That's a real problem, right?
We certainly have insulated consumers from the cost of most of their care, and that's going to affect their interest and ability to shop for care.
So again, that's just obvious. We've driven consumerism out of healthcare, which means we've driven all the benefits of free market competition out of it, by and large. Mr. Martin, you talked about now 76% of physicians are employees. It wasn't that long ago that about 80% were independent. Mm-hmm. And they were at the top of the treatment pyramid. I think one of the huge problems in COVID is doctors were at the bottom of the treatment pyramid. And listen, protocols make sense, but we're in the midst of a pandemic. You want doctors using the medical judgment and coming up with a different theory of the case and being able to use their off-label prescription rights. But they didn't do that. So I think as we're looking for solutions, we need to look at some basic principles of what we need to do to get back to more consumerism, to get back to more providers. So, Dr. Cooper, again, the current market is literally just a couple of consumers, Medicare and a few large insurance companies, right?
Correct. Three large payers.
And in terms of suppliers, now we have half a dozen large hospital corporations. So you've got these, a couple consumers, a couple suppliers, and shouldn't we be looking at, rather than putting Band-Aids on the dying patient? I completely agree with your regulatory burden. Well, as long as you're going to have just a couple, large buyers, and one of them is the federal government, we don't have consumerism going on, so the federal government's going to regulate. They're going to say, okay, well, this isn't working. We're not getting a loan on its price, so we're going to try and slap this Band-Aid on the dying patient. It's not going to help the patient live. So I guess my point is, let's figure out the basic principle in terms of the root cause of this, since we need to reintroduce consumerism to the extent we can. I know it's not perfect, but to me it's higher deductible or catastrophic insurance. I mean, real insurance, and then somehow get consumers to pay for as much as we possibly can in terms of health care. Any of you want to comment on that?
Yeah. Well, just two quick points for me. I think there's a large amount of innovation that is really trying to drive a return to clinical autonomy. And clinical autonomy, creates an empowered relationship between a physician and a patient or a clinician. And I think that's really important. And I think the investment that allows that to happen is important. The other thing is the AAFP and others have been very active in helping physicians, particularly family physicians, create direct engagements with both patients and also with businesses and through direct contracting models. And I think that's innovation.
So I just met with a group, and I've seen doctors that have just left the system.
Yeah.
They've opted out of Medicare, and they're just charging cash to farmers in Wisconsin, $55 for a half-hour appointment. Now, they need access to a hospital. They need, So I guess one thing I want to hope that we don't do here is crush out that initiative. I heard one of my colleagues talk about, concierge care. I mean, I get that, but we want people to have the freedom. We want doctors to have the freedom. Again, I want to see a shift. I want more doctors to become independent. I want more consumerism in the healthcare industry. I think that's the direction we need to move in terms of anything we do here. First, do no harm. Let's go back to a model that would reintroduce consumerism and give that choice and give doctors the autonomy, put them back at the top of the treatment pyramid as opposed to being crushed at the bottom of it.
Senator Brown.